Hello and welcome to RBJC.com. In this segment, we'd like to discuss elastic wraps, whether it be for an acute injury, one that's happened here recently, or a chronic injury, one that's lasted you for a while. We'd like to discuss some ways to support that particular joint or that group of muscles. And usually we do that with an elastic wrap. They come in all sizes, all types. You can spend as much as you want or as little as you want. This is a 2-inch, this is a 4-inch, and this is a 6-inch. Obviously, depending on the body part or the joint you're trying to support, I think that'll dictate what size you get. They usually come with a metal clips, or you can have some that come with the Velcro enclosures for themselves. This is pretty convenient, especially if you end up having to do it by yourself. You can wear them at work, at home, you can wear them at night, although there are some precautions we'll discuss about when using elastic wraps. But first, let's talk about using the wrap and the correct ways to do it. What I'd like to show you now is how to support a thumb with a 2-inch elastic wrap. On another segment, we discussed about what was called a taping for a thumb spica, and this is very similar. So the technique that you use for taping is very similar for wrapping. Obviously, we would suggest this more for pain and swelling controlling, where the taping was more for being athletically involved. So all you want to do is take the 2-inch elastic wrap. I'd like you to start, and you're just going to go around the thumb. Come back up, across the palm. Remember, check your tension. You don't want any tingling of the fingers, and then you can take it back and use the access of the elastic wrap on the wrist, and it does help to stabilize that thumb a little bit. It does feel a little more comfortable. Use your clips. Again, checking for tingling on the fingers and the thumb. You want to make sure it's good. It does allow for some comfort. As with all elastic wraps, as well as taping, you want to make sure that it is comfortable, it does support, and you want to make sure that there's no tingling in the fingers, then the elastic wrap is on too tight. Just loosen it, roll it back up, start again, and with practice, you'll find that perfect balance where it feels very comfortable yet provides support for you. We would like to show you how to use a 4-inch elastic wrap and the metal clips in supporting an ankle. Pretty easy to do. Takes a little bit of practice, but again, you're looking for comfort in the ankle, supporting the injured site, and helping to control swelling. It is a little difficult to wrap your own ankle, but with a little bit of practice you can get after it. Again, we're using a 4-inch. All you can do is simply cover the top of the foot, come down behind the heel, across the top again, back behind the heel, one more time behind the heel, and then you want to take it towards the top of the ankle, the lower leg. Again, using your metal clips. Anchor them in there. You want to check for comfort, for tingling in the toes, and also for the fit at the base of the calf. Again, you're looking for controlling of swelling and a little bit of pain and ankle support. For this particular example, we'd like to show you that you can wrap a knee for support, and we are also using a different type of elastic wrap. This one has its own Velcro, so it is a pretty self-contained unit. And you'll see that as she applies it on, it's fairly simple to use. Whichever elastic wrap you decide to go with, they're basically the same. We like you to start below the kneecap, just bring it around. In this case, she uses using the Velcro, so it does wrap itself. You're heading up towards the middle of the knee. Again, keeping your tension pretty even. Again, you practice at it, I think you'll get the hang of this. It's not too difficult. You bring it right back down, and you're basically going to end where you start. And in this case with the Velcro, it simply just latches onto itself. You don't have to worry about the pins in this case. And you're looking to try to keep it equidistant. Again, you want to make sure it is supportive of the joint and that there isn't a lot of pain radiating down. You don't want your leg to go to sleep, the lower leg, so you can adjust it as you need it. Remember, whether you're using the type of elastic wrap that has its own Velcro closure or just the good old standard ACE type of Band-Aid that comes with the metal clips, always remember the precautions we talked about. Number one, make sure it does support the particular joint or muscle group that you're using. 2, check for tightness, for tingling on the extremities. You want to make sure that it doesn't cause numbness. If it does, simply take the wrap off, put it back on. We also caution against using any type of topical ointments underneath the wrap. It's not a good idea because you can never tell what's going to happen underneath between the skin and the wrap. If you do ice yourself, obviously you can ice with the wrap on. We prefer that you would ice that particular body part without the elastic wrap on there and then put it back on. All we can say is use the wraps, let them do their job. And once again, on behalf of Richard Bone and Joint Clinic, we'd like to thank you for visiting. And always remember, rbjc.com.